Getting you news from the national capital now. The Federation of Resident Doctors Association vows to intensify their protest over the delay in NEET PG 2021 counselling from today onwards. The resident doctors of center-run hospitals like Safdarganj Hospital, RML Hospital and also the state hospitals in the national capital will be boycotting routine as well as emergency services from today. In fact, resident doctors from all government colleges in Maharashtra will also join the protest from today. Maharashtra resident doctors have said that they will not participate in OPD services. Remember, resident doctors have been protesting since the centre postponed counselling for NEET AIQ after it told the top court that it would relook at the income ceiling of ₹4 lakh for the EWS category. In fact, Ayushman Kumar is joining us live from one of the hospitals which has been the epicenter of this particular protest. Ayushman, you are live from Safdarganj Hospital. Good morning. First of all, if you take us through the current situation now that the resident doctors have decided to boycott the routine as well as the emergency services, it is just going to escalate problems for the patients, hundreds of patients who flock the hospital every day, not just from the national capital, but across the country. But you can't blame the doctors as well.
Yes, Gauri. In fact, very good morning to you. If you see the current situation, the Federation of Resident Doctor Association has said that right from 27th of November, they started giving out letters and the protest started. First, it was the OPD. Then on 3rd of December, they decided that routine work will also be impacted. And now, from today onwards, they have said that they will also be boycotting the routine emergency also. So the emergencies and OPDs and other services are definitely going to be impacted. We are outside Safdarganj Hospital, where if you see the situation right now, we are being currently told that from 9 a.m. this protest by the resident doctors will start. We already know that this hospital is one of the biggest hospitals in the national capital, and it currently acts as a very, very important catalyst for holding all those patients who are coming from northern part of the country as well as southern part of the country. And a protest like this is definitely going to impact the routine patient care services that we are seeing. Yesterday, in fact, on social media, we saw one of the patients complaining about the treatments not being given to people who were there in the critical care. When we reached out to the Resident Doctor Association, they said that somewhere from tomorrow they are boycotting these services. So emergencies are working. But till now, Safdarganj has not given a statement on what is happening and how is the situation, how are they managing. Because any hospital of center or state, the services of resident doctors remains very, very crucial. And at a time like this, when we have seen the COVID pandemic and post-COVID care, for that people are coming in a larger number, the Resident Doctors Association's boycott of all the emergency services is definitely going to cripple the entire system of healthcare that we are seeing in Safdarganj, RML, or 4 other hospitals and primary hospitals of the national capital, which includes LNJP, GTB, and Ramanoorlohiya Hospital. So these are some of the hospitals which are very, very crucial as far as the patient care is concerned. And if the resident doctors are saying that all their demands are falling to the deaf ears of the government, this is the only way how they can tell the government that somewhere the PG counselling should start. So the fresh batch comes and an important decision-making has to be taken here, Gauri.
Right, and also Ayushman, we know that the nationwide stir of doctors has entered day 10 today, and more doctors are joining, and they are just intensifying their entire agitation. But the bigger question, of course, which is troubling everyone, is there a truce in sight? Are the authorities or the governments trying to reach out to these protesters to ensure any kind of breakthrough?
Well, Gauri, what has happened here is that from 27th onward, we were told that the OPD services would be, the RDA, the resident doctors won't be going for the OPD services. Then it was the routine services. Now, what crucially happens here is that they have written it to the Union Health Minister. So the centre clearly says that there is a process to it and the process has to be followed. Now, centre is saying that somewhere they are trying to meet the demands, but at the same time, the time-bound nature of the demand that the RDA has, or rather the resident doctors has, that is something which the centre is not quite making a clear statement on as to what is the timeline when we are going to see things getting fully done. And this is something which has been a demand of the resident doctors for a long. We have seen on social media the resident doctors have trended the topic like NEET PG counselling should be there. It's almost the year end, and if the new year batch doesn't come, the pressure ultimately goes to the people who are already there in the system. So this is something which the resident doctors are saying, that somewhere on ground the situation for them is bad, who have already handled the COVID pandemic. And currently what they need is a new batch to come in so that their situation can be somewhere also become better. And in protest of that only, we are seeing this over 10 days protest, and from today onwards, it is going to impact the emergency services as well.
Right, Aishman, thank you for sharing all those details from one of the biggest hospitals in the national capital, that is Safdarganj. Meanwhile, incidents of doctors not being available to attend the patients in NEET have surfaced. In one such incident from Safdarganj Hospital in Delhi, a video has emerged of a patient on ventilator where no doctor can be seen around. The hospital, however, in a statement said that the resident doctors at the hospital are working in all emergency rooms, ICUs, labor rooms, GRR, nurseries, even COVID and all emergency-related workstations which need immediate patient care. The statement also said that their protest as of now involved boycotting only routine non-emergency services that are being managed by consultants. Time to slip into a very, very short break. Stay tuned to Mirror Now.